we don't know what cancer he has got, and frankly, I don't think we should know. Good Lord, people, whatever job they're in, should be entitled to some level of privacy. But we're told it has been caught early as a result of his investigations for his enlarged prostate. So that is good news. Catching cancer early is crucial. But also, we know he's already started treatment. In terms of, not talking about him specifically, but men in their 70s, what are the cancers that that people should be looking out for and should be looking for the signs of? Because we know prostate obviously is the key one, isn't it? But what other cancers should people of that age, men of that age in particular, be looking for?
Um, Yeah, it's predominantly, as you mentioned, prostate cancer, bowel cancer, and lung cancer, more or less in that order, actually. But as you said earlier, the good news is that improved diagnostic tests and treatments have massively improved cancer survival, almost doubled over the last 50 years in the UK. But we still need men to be more aware of cancer.
Yeah, there are lots of campaigns for women. I mean, breast cancer is the #1 killer for women, isn't it? And that's been the one that that's been the one that all the focus is on, the pink ribbons and the running and everything. And most women I know are incredibly aware about that. But women are much better at going to the doctor, when we were allowed to go to the doctor, by the way. But getting a middle-aged or older man to the doctor is like pulling teeth.
It is, and that's why I think people need to be more aware of the really important just to go along and see your GP. The longer you leave it, the worse it gets. Early diagnosis is the key to successful treatment. And indeed, for many cancers, you can cure cancer
Yeah.
with early diagnosis, but you have to go along to your GP, and men are particularly bad at that.
Yeah, and we know a lot of it depends on when you're able to start treatment, but first of all, diagnosing it and then starting treatment. The reality is the King will have started treatment probably sooner than some other people because he was able to get that diagnosis very early. He was getting treatment fairly early because he's got private healthcare. A lot of people in this country have moved to getting private healthcare, even though they're struggling. They're not, millionaires. But they've got it anyway because they are worried that they are just not going to get their treatment on the NHS. The NHS was massively improving its numbers and its outcomes, as you said, on cancer treatments. But we still, in the NHS, we lag well behind most other comparable European countries in terms of your chances of survival 5 years after being diagnosed with cancer, don't we?
Yeah, we do, and that I think that is a combination of needing more public awareness of cancer symptoms, but also of trying to do our best to keep to the 62-day referral. That is that
Yeah.
there should be no more than 2 months between the date of your the hospital received an urgent request from your doctor if you suspected cancer
Can
and the
I just
start of your
say
treatment. And of course,
this
with
is
one thing and another.
Lawrence, this is where things go wrong in this country. The idea that an urgent referral from a GP could result in the time limit is 60 days, 2 months, waiting two
Yeah,
months to see a consultant, not to
exactly.
start treatment, to see a consultant. That's an obscenity in the first world. And that's what
It
people
is,
who could
and
only use the NHS have to deal with.
exactly, and that's why we need to do everything we can to improve early diagnosis and to get things happening quicker.
Yeah.
And it is a problem. We're dealing with an NHS that is under enormous strain, and it's a real worry that at a time when we have better diagnostics, we have better treatments, and we have better early
Yeah.
diagnoses, but those aren't being rolled out effectively because of all the pressures on the NHS.
Yeah, indeed. Well, look, there's a lot of talk, a lot of praise for the King when he was open about the fact that he was having treatment for his prostate, because there's some embarrassing things people don't like to talk about, and actually more men coming forward with symptoms and looking it up and actually going to the doctor. That will save lives. People who just don't have a prostate problem but could have prostate cancer, and that's always a good thing. We don't know what kind of cancer he's got, but given the cancers that are at risk, particularly for men of a certain age, tell us just a list of the symptoms that if you've got any or all or some of these are the ones that you really need
Yeah.
to make a GP appointment today.
Yeah, so a lot of it is sort of persistent problems. Certainly, if you've got any blood in your urine or in your poo, that's an important sign. Go to your doctor. Pain,
And go to your
persistent pain
doctor
in your
day
tummy or your
one.
back.
Day one on that
Yeah,
one.
I think if you've got blood coming out, if you're coughing blood or you're pooing blood or blood in your urine, you must immediately go to your GP. Some of the persistent symptoms of cancer are things like, pains in your tummy or your back or indigestion, and these things are sort of non-specific. But I think if they carry on for more than a couple of weeks, you really should go and see your doctor. Changes in bowel habit, persistent indigestion, and of course, one of the key symptoms of cancer is unexplained weight loss. If you're not doing anything to control your weight, but you're losing weight, that's a very significant sign that something is wrong.
Okay, so pay attention to that, folks. Let's hope that this all this talk, royal cancer, that it actually can save some other lives as well.